Rosie is a highly specialist physio in the Input Pain Management Centre, which I'm sure she will tell you all about, but has been very valuable to us as GPs over many years, which is at Guy's and St Thomas's. She's worked with pain management since the early 2000s and has trained and works with the acceptance commitment therapy approach. She has a background in dance and completed her first degree in dance. That's very impressive. She has an interest in emergent research that supports the role of the arts in health and continues to be fascinated by embodiment and the role of our relationship with our bodies and what we do with them on our mental and physical health. I will introduce you to Sue because obviously everybody's seen you, although you won't be speaking till later. But Sue Doyle is here, and thank you very much. Sue is a public engagement volunteer with the Royal Osteoporosis Society, and I'm sure will be telling us much more about that. She has been volunteering with the Royal Osteoporosis Society for over 10 years. And is the chair of the Ashton, Lee and Wigan Osteoporosis Support Group, and they do have in-person and online meetings now. She's been a member of the Royal Osteoporosis Society Members and Volunteers Committee for over 3 years and is one of their presenters who deliver osteoporosis awareness talks, both in person and online. And the third person who I don't think we can see is Magda Ukik, who is a local pharmacist who's been working in primary care for the past 2 years. Prior to that, she was working in community pharmacy for 6 years. She qualified in Poland and has recently become an independent prescriber, particularly interested in hypertension, high blood pressure. So if it's okay, Rosie, I will hand over to you. So Rosie is going to give us a presentation and then we can there'll be time to ask questions at the end, which you can put in the chat sign. So over to you, Rosie.
Thank you, Audrey. So I'm going to talk about persistent pain. Persistent pain is often called chronic pain as well, or long-term pain. And it's any pain really that lasts longer than 3 months. And I'm going to explain a little bit about what we know about long-term pain or persistent pain first. I think most of us grow up with a good understanding of what short-term pain, also known as acute pain, is. We kind of expect pain if we get injured or we're ill, and then we expect it to go away again. But it's a bit different really with this long-term pain. So I'm going to spend a bit of time talking about that. But first of all, just to say, if you do live with pain ongoing, you're not alone. It affects a lot of the UK population. And indeed, it's one of the main causes of disability in the world. Now, pain, as you're probably aware, can happen for a lot of different reasons. It might come on with an injury, but then it might not go away. It might be because of health reasons like arthritis, or it sometimes also can start for no obvious reason. The other thing that I want to say is really important is that actually pain is really complicated. We know more and more about the pain system and long-term pain, but there's still a vast amount that we don't know, unfortunately. But, you know, research is ongoing. A lot of the structures in our bodies can cause pain, but actually the pain system is within our nervous system, which itself is extremely complex. So I think it's a kind of pertinent question to ask, why do we actually have pain in the first place? Because it's unpleasant. None of us really would want to feel pain. And actually it's unpleasant because it's been specifically designed to be that way so that we pay attention to it. And the bigger role of pain, which is also quite important to know, is that it's designed to keep us safe. So it actually acts as a bit of an alarm signal to alert us to a threat or a potential threat. And actually, as children, we learn a lot about pain as we're growing up. We learn that we shouldn't put our hand on something hot because it will hurt, or we shouldn't touch a sharp knife, or if we jump from a very high wall, actually, that might be painful and cause us an injury. So we learn to kind of navigate our world and keep ourselves safe through pain. And also, pain is, as I said, an alarm signal, and it makes us behave in a particular number of ways. And those ways that we behave when we feel pain can actually protect us and keep us safe. So, for example, if we do injure ourselves, we feel pain, it makes us pay attention to the bit that we've injured. It might make us go and get help. It might make us adapt our activities. We might rest. We might avoid moving the area. We'll pay a lot more attention to that area. And all of that actually helps our body to heal. If we didn't know we'd injured ourselves, if the pain hadn't told us and we carried on as usual, actually, we would maybe not survive, or the injury certainly might get worse. So it is a useful alarm signal, but actually it's designed to be a short-term alarm signal. And as I said at the beginning, this is really how most of us grow up understanding pain, that it comes on when we've done something or we're unwell, and then it should go away again. However, for a lot of people, unfortunately, it doesn't go away. And the reason that 3 months is used as to when it goes into being chronic or persistent pain is because actually most things in our body heal themselves within 3 months. They might not heal perfectly, just like we get a scar on our skin if we've cut ourselves badly, but they will have healed. So pain is an alarm signal, but when it doesn't go away, it becomes a bit of a faulty alarm signal. And it's a little bit like those really annoying car alarms that I'm sure you've experienced that just go off for any reason. A cat might crawl underneath it was a bit windy, and the alarm will go off. Now, the car alarm is just designed to go off if someone is breaking in. But what happens is the car alarm system becomes too sensitive. So we know that with persistent pain, our bodies and our nervous system undergo a lot of changes, and the system does become more sensitive. The threshold at which it gets triggered is lowered, so it's triggered way more easily. We also know it can randomly trigger, so it doesn't matter what you do or don't do, it can randomly trigger the pain. And for those reasons as well, it's a very difficult thing to live with because it's triggered really easily just from you doing normal everyday things. And also it can be randomly triggered. And again, just to revisit the fact that pain at this point, because of this sensitized system, becomes a thing of itself. So often that alarm of pain is still being sounded, even though there might not be any good reason to. And a good example of this is phantom limb pain. So we know that if people have had limbs amputated, they can still often feel that limb. So they might feel an itchy foot, they might have pain in their foot, but their foot is no longer there. So this is a really good example of actually the pain system is triggering this pain. It's lost that link as to why it might have gone off in the first place. So scholars and clinicians and scientists have kind of thought about what is pain for many years, and this is a bit of a summary of the definition. An unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. So I think the important thing to pick out from this is that actually it involves an emotional experience. So I think as human beings, we don't just feel nothing about pain. It's unpleasant, so generally we have an emotional response to it. The other thing is to just highlight that it can be present when there is tissue damage, but equally it can be present when there isn't tissue damage, just like with that phantom limb pain. And actually, even quite severe amounts of pain can be present when there's no evidence of anything kind of really being wrong with the body. It's the pain system that's just ramped up. I think it's important to address these questions because often if we say, there's nothing physically wrong or those kind of things, people understandably can feel that they're being told it's all in their head. And absolutely, it is not. The pain system is hugely complicated. It's within the entirety of the nervous system. And so the pain is real. And also the question, is it my fault? So no, it's not anybody's fault if you have pain. It might be, emerging research shows us it might be some of us genetically may be more prone to developing long-term pain. It might be our life circumstances may affect how likely we are to get persistent pain, but it isn't anybody's fault. So it's unpleasant. It's difficult to live with. And so the impact of living with long-term pain can be quite huge. It tends to affect lots of different realms of people's lives. So it can affect activity. So we feel pain within our bodies, and therefore, understandably, it can be difficult to carry on doing the usual activities that we normally do. It can affect our relationships because pain is designed to be unpleasant and to make us pay attention to it. It can actually hog the limelight a lot in life. It can really take up quite a lot of time, people noticing the pain. Not only our kind of relationships, but also our sexual activity as well can be affected. We might try and reduce how much pain we've got by stopping things. So over time, we might find we're doing less of what we enjoy doing. Our hobbies or interests might suffer. It can be hard to be with others at times if we've got pain. So socializing might be affected, can affect our sleep. And all of this can have an effect on our mood, understandably. So it's multifactorial. Pain is something that affects lots of things, and lots of things in turn affect our experience of having the pain. So if generally things aren't going well in life, often our experience of pain is heightened. A bit like if you're having a stressful day and you have an injury, you might feel the pain of that injury more than if you're relaxed and on holiday. So the multi-million-dollar question is, what can I do about it? And with long-term pain, with persistent pain, what can you do to try and reduce the pain? Unfortunately, there's only a limit in terms of what medicine can do, for example. So medications can help, but often it's weighing up how effective they are with the side effects, because if you're living with this long term, thinking of taking medications long term, that's an important thing to consider. And so where we are at the moment is really that the evidence shows that looking at the impact of pain and looking at what can be done about the impact of pain may be a better route to helping the experience of living with long-term pain. Now, unfortunately, there's no easy, this is what you need to do if you live with pain, because everybody is different. Everybody's body is different, everybody's pain is different, everybody's life is different, the things that are important to you are different. So there really isn't one kind of thing that I can say for everybody, but there are some themes in terms of looking at that impact of pain that we can pick up on to as things to sort of have a look at what might be helpful to address. So I know this is a very busy slide, and I'm hoping you'll kind of ask me a bit more specific questions in the question time, but generally keeping active is important. We all know that it's good for our health and our bodies to keep active. When you've got pain, you often need to take a different approach. You might need to be a bit gentler with yourself. That no pain, no gain often doesn't work very well. That can just escalate things. So you might need to kind of learn different approaches, maybe take things slower, getting back to activities or starting new ones. You might have to be a bit flexible in how you approach an activity. So whether it's getting the shopping done or going to a class, because pain is variable, you might have to approach it a bit different on one day compared to another. You might need to do less on one day compared to another. And that's often not easy for us as humans to do. We kind of have a way that we like to do things. Also, as we've looked at, pain generally involves us feeling something about it. So it's important to make space for that and recognize the impact that it has and give some time and space for that. And also recognize when that's getting unhelpful and also when you might need help with that. Connecting with the present can be helpful because often with pain, we very easily think about how challenging it's been and all the difficult things that have happened in the past. And also we worry about the future. So doing some mindfulness practice, connecting with the present moment can be really helpful in managing that. Doing what's important to you. So as I said, with pain, often an attempt to control it, it's very common that stop doing the things that you enjoy doing. So looking at ways of reconnecting back with things that are important to you can improve the experience of living with pain and improve that sense of having a quality of life alongside living with pain. Pain can lead to isolation, and we know recently there's been a lot of research about loneliness and isolation and the impact that has on health as well as our mood. So looking at maybe making some connections again. Sometimes online groups, community groups can be a good place to start with that. And also this is a long-term condition, so knowing what support there might be around you and asking for help and utilising it when needed. So that is a real whistle-stop tour of pain. There's so much to say about it, but I'm going to go over to you now for questions.
Thank you very much, Rosie. There aren't any questions in the chat box yet, but I expect there will be quite soon. Could you give any kind of examples of, people who, how they've sort of progressed through, I mean, I hate the word journey because it's so hackneyed or whatever, but a sort of pain journey, and maybe how somebody has been helped to move from a sort of a very difficult situation and perhaps, move to a better situation.
Yeah. So maybe one that particularly looks at connecting back with things that are important to you, that quality of life idea. So as you said, Audrey, here at Input, we run pain management groups. So we have a lot of people kind of coming through and working with the pain management programs. And, all of them are dealing with the impact that pain has had to a greater or lesser degree in probably all of those domains of life. So one person that springs to mind is a young man who used to play semi-professional football. He, because of pain, was no longer able to do that. And that was a big passion in his life. He was able to really have a look at why football was important to him. So one thing that was important was exercising outdoors. One thing was being in a team the other thing, being competitive and also supporting the younger players, that sense of kind of nurturing. And looking at those things, he was able to identify where he couldn't play football, but could he do something that was about being active in the outdoors? And there were other things that it was possible for him to do that weren't football, that involved ticking that box, if you like. He could also find a different sense of being in a team of people that wasn't football. He could also connect with that joy that he got from being competitive. It wasn't going to be competitive with football, but he could do that in another realm. And also there was another different place that he could do that. Actually, in the end, he was still helping develop the young players in a football kind of context, but he could easily, if that wasn't available to him, found some way to kind of nurture and support others in a different context. So sometimes it's about looking a bit sort of outside the box and thinking about, why is it that I really enjoy that thing that I no longer can do, and seeing if there are other ways that you can connect with that. And that, as I said, can be actually quite profound in terms of then you're getting that sense of quality of life, connection with others that previously might have just been lost and gone by the wayside.
Thank you, that's really helpful. So one question is there anything we can do now to prevent chronic pain as we age?
As I said, it's, you know, it's nobody's fault why they get chronic pain. So, you know, there's no kind of cast iron way to avoid it happening. I guess in terms of physical health, it's helpful to keep moving. So all of that general advice about keeping active, keeping, you know, your joints moving by using them, can be helpful. And I guess also just looking at generally that sense of well-being. So I think all of this applies to all of us, whether we live with pain or not. Those different realms of life that are important to us, keeping our mental health good, keeping connection with others, using support when needed. So maybe a sense of looking after yourself holistically will at least serve you much better should you unfortunately start to get pain as you get older.
Thank you, thank you. And another question, perhaps you could tell us a bit more about common medical conditions and diagnoses that tend to cause chronic pain.
There's so many. There are so many. I probably wouldn't know where to start.
Are there particular patterns of things that you sort of see, or a kind of a typical presentation, would you say?
Okay, so I don't know whether this one thing that we do see, and it comes back to pain, can be present in the absence of there being anything kind of physically wrong. So other reasons pain seems to be prone to developing is from trauma.
Mm-hmm.
So there's a strong link with having, it can be a traumatic episode. It might be you've had some kind of lots of little traumas or difficult time in your life. That can be something that means that you may be more prone to developing pain. And I think that is a good example of how linked our mind and body are. And certainly with the pain system sitting within our body, sitting within the nervous system, it really demonstrates that link.
And I mean, I think as you perhaps suggested or said, that people might say, well, are you saying this is all in my head, or, you know, are you somehow saying it's my fault? How would you kind of talk to somebody or try and encourage or reassure people that that's not what you're saying, even though there may not be a broken leg or, you know, something that you can demonstrate on a scan or whatever.
Yeah. I mean, I think first of all, acknowledging that it is a hard thing for us to get our heads round often, or for someone to understand, is that there's nothing wrong. Because as I say, I think we grow up thinking that really there needs to be something wrong in order for there to be pain. So acknowledging that, and also the frustration that often people feel when there isn't an investigation that can show that something is wrong, but also to highlight that there is a lot of research, and we really do know that it's this pain system that's being affected. Although we can't see it with scans, we know from the research that there's physiological changes that happen within the pain system, and that's why it's more prone to being triggered. And so the pain is being, whatever reason pain is triggered, when it's triggered, it is real.
Yes, yeah. And I mean, I suppose for most of us who do not have chronic pain, you know, we're used to maybe having a headache or a sore knee or whatever, and we take some paracetamol and it goes away. I mean, and I'm assuming that often when you see people, you know, they're often on a lot of painkillers or a lot of medication. How do you kind of work with that?
In terms of the pain
Well,
medication.
yeah, I mean, in terms of, I mean, because, you know, often that in itself, the more medication you have, the more side effects, the more ill effects you have altogether. So, I mean, do you try and reduce people's medication? How would you approach that?
So what we do here is that our specialist nurses will run education sessions. So really it's empowering people to know about the pain medications. So there's a number of different types of pain medications that work on different systems, and they all come with their own short-term and long-term side effects. So it's empowering people to know what the pain medications are aiming to do, what the side effects might be, what they need to weigh up, really, and offering support with coming off them if that's where they decide to go with it. There is a thing that can happen, particularly with opioid medications, is that in the end, the medications themselves can start to cause pain. So it's education like that that can just give people the knowledge, and then they can decide what's going to work best for them. And I think it's useful to say at this point that one of the things that's difficult about living with pain is that it's invisible. So often people find it hard to have conversations with people because it's not a visible thing.
Yeah, yes. There's a question in the chat box, which in fact Magda, thank you very much, has answered, but maybe I will read it out in case Ella, the questioner, isn't sure if it's been answered or not, and maybe both you and Magda could contribute. Is it possible to control a chronic pain using a patch with a small dose of painkiller, and if which, so in which painkillers are used?
I would say I don't deal with the prescribing medication side, so I can't really advise on that, other than that general advice that really it's weighing up the pros and cons of taking them long term.
Yes, yes. So I don't know, Ella, if you're there, whether has that answered your question? Maybe you could, I don't know if you're able to temporarily unmute yourself to say yes or no, sorry. Or maybe put it in the chat box. That would be helpful. Okay. Well, at the moment, there are no other questions coming, although I'm sure that we do all have questions. And I think that's been a fascinating talk. Thank you very much. And I mean, I do, I have, as I say, I've had some experience of the input team for many years. It's probably changed quite a lot over the years, but that's really helpful. So where do you work in general? I mean, Rosie, are you mainly doing outpatients work, or do you see people as inpatients? Who do you mainly deal with?
So we're not an inpatient service, other than that we do run residential programs. So people come and stay in the hospital, but they're not admitted, they're not on a ward, they stay in flats, and they come and do our 3-week program. So because of COVID, we've changed a lot over the past 2 years what we've been offering, and we have, through COVID, been running virtual programs. Currently we are still running some of those, but we're more kind of getting back to our face-to-face programs. And so we do also offer, as well as the quite intensive 3-week residential program, we do run a more of a kind of outpatient program, which is for people within our local catchment area. And we also have a few other kind of options as well for people who might not be able to access that.
Great. And lastly, are there any websites or sort of resources that you would point people to?
There are probably, there's lots actually, and I think again with COVID, that was a positive that came out, was that a lot of stuff started to go up online. Maybe the best thing I can do is send a list of resources that is available. Will there be somewhere where people can access this sort of?
I think what can happen, Catherine, correct me if I'm wrongly, is that if you did send that, I mean, either put it in the chat or send it to Catherine, and she can email it out to all the participants. That would be really very helpful. Thank you. That's a really, really helpful overview, and that's great. Actually, sorry, there was just one question that has just come up, so let me just quickly Beverly asks, I run an over 55s program, and we have people who come and start every visit with a summary of their pain, but the distraction of an activity seems to make them forget about it during that hour. Are there particular activities that you'd like to see more available to encourage people to attend?
I think it really just does depend. So, if gardening's your thing, do gardening. You don't have to do a gym thing to kind of be active and improve your fitness. Generally we tend to stick at doing things that we enjoy doing. So find something that for you has the added benefit that you actually enjoy it, and see if you can seek that out. The social prescribing scheme can be quite useful if you're not sure what's in your local area and you're wanting to connect with others, connect with groups, find way of identifying, where there might be activities going on that you could enjoy. That's a good thing to bear in mind.
Great, lovely, thank you. And just to plug social prescribers, so every GP surgery, certainly the local GP surgeries, have a social prescriber who is, as Rosie said, able to has a lot of information about local groups and things which are kind of, non-medical in inverted commas. So that's really a helpful thing. And also, we do also have health coaches, which are different, but will try and sort of really concentrate on any areas of health that you feel you want to focus on. Thank you very, very much, Rosie.